Aging brings many changes to the male body, some expected and others surprising. Sexual health is often overlooked in discussions about elder care, but it remains a vital part of overall well-being. Masturbation, a topic often shrouded in taboo, can provide a multitude of health benefits when approached with understanding and care. As a urologist, I have observed that older men who embrace safe and mindful self-pleasure can experience improved prostate health, enhanced circulation, better emotional balance, and increased confidence. Recognizing that masturbation is normal and healthy is the first step toward maintaining sexual vitality. Many men feel embarrassed about engaging in self-pleasure at an advanced stage, yet medical evidence suggests otherwise. The prostate, a walnut-sized gland surrounding the urethra, plays a key role in male reproductive health by producing seminal fluid. With age, men may experience benign prostatic hyperplasia, characterized by enlargement of the prostate that can cause urinary difficulties such as urgency, frequency, and incomplete bladder emptying. Regular ejaculation, whether through masturbation or sexual activity, helps maintain prostate function. Research indicates that frequent ejaculation may reduce the accumulation of potentially harmful substances in the prostate, lowering the risk of inflammation and, in some studies, potentially reducing prostate cancer risk. Men who incorporate regular ejaculation into their routines often report fewer prostate-related discomforts and improved urinary comfort. Testosterone levels naturally decline with age, leading to decreased libido, reduced energy, and changes in mood. Masturbation stimulates the release of testosterone and other beneficial hormones, supporting sexual drive, physical stamina, and mental well-being. Many older men experience feelings of inadequacy when their libido diminishes, but understanding the hormonal benefits of masturbation can help combat these concerns. It is essential to normalize masturbation in later life. Older men should understand that self-pleasure is not a sign of loneliness, immaturity, or sexual deficiency. It is a legitimate aspect of sexual health and self-care. Erectile function is largely dependent on vascular health. An erection occurs when blood flows into the corpora cavernosa, causing the penile tissue to expand and stiffen. Age-related vascular changes, including atherosclerosis and reduced endothelial function, can compromise this process. Regular masturbation stimulates blood flow, maintaining tissue elasticity and responsiveness in erectile tissue. It functions as a form of mild physical exercise, supporting the health of penile blood vessels and nerves. Studies have suggested that men who ejaculate frequently may have a lower risk of erectile dysfunction because regular sexual activity helps maintain endothelial function and reduces the stiffness of penile tissue. Masturbation also provides mild cardiovascular exercise by increasing heart rate and promoting systemic circulation. These effects extend beyond sexual health, contributing to overall vascular well-being and cardiovascular endurance in older men. In addition to its physical benefits, masturbation offers profound psychological advantages. Aging often brings stress, anxiety, and emotional strain, and masturbation serves as a natural outlet for emotional regulation. During masturbation, the brain releases neurotransmitters such as dopamine, oxytocin, and endorphins, which reduce stress, elevate mood, and promote relaxation. Men experiencing insomnia, anxiety, or low mood can benefit significantly from these physiological effects. Furthermore, masturbation encourages self-awareness. Older men who explore their own bodies learn to understand sexual responses, preferences, and physical changes. This knowledge enhances intimacy with partners, fosters emotional resilience, and promotes self-acceptance. For men living alone or in assisted care, masturbation provides a healthy outlet for sexual expression and reinforces the idea that sexuality is a lifelong experience. Sleep disturbances are common in older adults due to stress, pain, or hormonal changes. Masturbation can aid in achieving restorative sleep because orgasm triggers the release of endorphins and oxytocin while reducing cortisol levels, which facilitates relaxation. Incorporating masturbation into a bedtime routine provides a drug-free method to improve sleep quality, helping older men maintain energy, mental clarity, and overall health. Sexual health and self-esteem are closely intertwined. Men who maintain an active sexual life, whether solo or partnered, often report higher self-confidence. Masturbation contributes to this by allowing men to understand their own bodies, improve body image, and sustain a positive sexual identity. Men who practice self-pleasure mindfully are better equipped to navigate intimacy, adapt to physical changes, and maintain a sense of sexual competence. Self-confidence gained through sexual awareness also extends to social interactions, encouraging older men to remain emotionally engaged, assertive, and connected with others. Many men struggle with the perception that sexual desire should diminish with age. Masturbation helps normalize sexual expression at any stage of life. Embracing self-pleasure challenges societal misconceptions that sexual activity is reserved for youth, reducing guilt and promoting a healthy attitude toward aging. Sexuality. Understanding that sexual needs persist allows men to adapt routines, explore new forms of pleasure, and maintain a fulfilling sex life. Hygiene is another essential consideration. Maintaining cleanliness before and after masturbation reduces the risk of irritation or infection, which is particularly important for older men with more sensitive skin. The use of water-based or silicone-based lubricants can further enhance comfort, prevent friction-related discomfort, and support safe, enjoyable self-pleasure. Attention to hygiene and lubrication ensures that masturbation remains a safe and positive activity throughout later life. While masturbation is generally safe, certain conditions warrant medical consultation. Pain, bleeding, urinary difficulties, or sudden changes in sexual function should prompt evaluation by a urologist. These symptoms may indicate underlying prostate issues, hormonal imbalances, or vascular concerns. Regular checkups provide an opportunity for older men to discuss sexual health openly, receive personalized guidance, and address potential complications early. Masturbation can then be safely integrated into an overall plan for maintaining urological and sexual well-being. Moderation is also key. Excessive masturbation can lead to fatigue, temporary genital irritation, or distraction from daily responsibilities. Listening to one's body and maintaining a balanced routine ensures that masturbation provides long-term benefits without negative effects. Frequency should be individualized according to energy levels, physical condition, and personal needs. There is no universally correct number of times to masturbate, but consistency and mindfulness are crucial to maximize the benefits while minimizing discomfort. Masturbation complements, rather than replaces, emotional intimacy and relational fulfillment. Understanding one's own sexual preferences and rhythms enhances communication and satisfaction in partnered sexual activity. Older men who practice masturbation mindfully are often better attuned to their partner's needs and more comfortable expressing desire. Sexual well-being encompasses physical, emotional, and relational dimensions, and masturbation supports this holistic approach. By integrating self-pleasure into daily life, older men reinforce the connection between mind, body, and relationships, maintaining a sense of vitality and personal identity. Masturbation also fosters resilience, adaptability, and acceptance of the changes that accompany aging, allowing men to approach sexual health with confidence and clarity. Overall, masturbation is a natural, healthy, and beneficial practice that supports prostate health, vascular function, emotional balance, sleep quality, and self-confidence. It normalizes aging sexuality, reinforces hygiene practices, encourages moderation, and strengthens relational and emotional connections. Older men who embrace self-pleasure with mindfulness and medical guidance can enjoy a higher quality of life, maintain sexual vitality, and approach aging with confidence and self-acceptance. Sexual fulfillment is not limited to youth, it is a lifelong journey, and masturbation provides a safe, effective, and enjoyable pathway to maintain pleasure, intimacy, and overall well-being. Aging does not signify the end of sexual health but presents an opportunity to deepen self-understanding, optimize bodily function, and sustain emotional and relational satisfaction. By recognizing and applying these principles, older men can fully integrate masturbation into a holistic approach to health, promoting longevity, vitality, and happiness in later life.